still waiting for news of a possible tightening of the lockdown over the coming Easter weekend. Many of the scientists on the Ministerial Advisory Committee say it will be prudent to do so. Cabinet, of course, is considering this at the moment. In the meantime, it seems there is a bit of an uptick in COVID-19 infection numbers. Let's discuss this now with Professor Adrien Puren of the National Institute of Communicable Diseases. Professor, good evening. I've had a little look at the numbers. And it's a little bit all over the place. It seems to fluctuate between sort of 500 and 600, right up to 1,500 every day, going back a week or so. Is it too early to say whether there is a definite upward trend in our numbers?
No, at this time, Sally, because I think we spoke a week ago, and in fact that trend just simply continues. There's no real evidence that we are entering a different phase. In fact, those numbers are, as you said, are quite variable or fluctuate a great deal. When you try and smooth that out, you can certainly see that it's actually far lower than actually the first speakers as well. So I think overall in the country, we certainly need to be on the alert. But in fact, the upticks and so forth are really not really evident at all. There may be particular clusters, and I guess the Northern Cape is a good example of that, where again you could certainly see a marked uptick compared to the other provinces, but that seems to be declining as well. So I think it's really making sure that we have a good measure of what's actually happening in order to preempt, and I guess that's what those discussions are around, any indication of a surge.
Of course, because as soon as we hear there isn't a definite upward trend as yet, the inclination, and it's human nature, is just to go, well, you know what, we can take a breath, because this pandemic really is a marathon. But I suppose there's danger in that. Would you support some sort of extra restrictions over the Easter weekend?
Well, I think it's really taking those factors into account. So I think it's really, as you said, the Cabinet is going to make that decision based on what the current observations are. But given that there are risks, certainly, you need to then decide whether or not preemptively, because again, you come back to the point about super spreader events, where there are large congregations of people, the restaurants are open, the malls are open, large numbers of people coming together, greater mobility, poor ventilation in particular areas. You may well then consider some type of interventions. And again, these interventions can vary. They can be really be nuanced. It doesn't have to be one attempt at everything. It could be in specific areas where you could certainly focus on in order to try and ensure that you prevent those particular types of events going. But it also comes back to communication as well. I think it's really critical that we communicate regularly with the larger South African population to say, look, we're at this particular point, we're out of wave 2, we know that there are risks, and admittedly, we're at a low ebb at this particular point. But if we do the following things, and if you also do the following things, we can actually try and manage this in order to avoid a third wave.
Absolutely. I wanted to speak to you about the vaccine rollout program. We know that Johnson & Johnson delivered 40,000 more vaccines on Friday, so we've got about 300,000 in total, some administered, some not. About 220,000 have been administered. We have also heard from the Health Minister that we are going to miss our target to vaccinate 67% of the population by the end of the year, but he's saying by February next year he's hoping that we can do it. But bearing in mind it is so very difficult to know how reliable your access to vaccines is going to be, what do you make of what we're in for the rest of the year as we go into the second year of COVID-19 in terms of the vaccine rollout?
Yes, I think, I know that we started off focusing really on the healthcare workers. So again, coming back to your point about, what do we really need to do? And I think trying to get as much vaccine available to our healthcare workers as a start, I think will really be an important start, because they really were severely infected. And if we are going to go towards that sort of third wave or fourth wave scenarios, then I think that's really going to be a critical point. But I think, given that there may be critical problems around supply chain, the availability of vaccine, the competition that there is, I think we're really going to have to be patient and really see how we're going to manage going through this, given that those particular challenges certainly exist. So expanding it is really a major challenge, as I'm sure the health industry has already indicated. So how do you manage really making sure that you have larger numbers of staff, making sure that your logistics and all those those elements are in place. And also, I think also making sure that the public is with you in terms of actually making sure that when the vaccines are available, that they have access to it and make use of it. Yes.
Well, thank you so much for your time this evening. We really do appreciate it. That, of course, was Professor Adrien Puren. He's from the National Institute of Communicable Diseases.